We'll stay used. Up here with me. Thank you, Mr. Chair and members. Very happy to bring to you AB 1893, along with my joint author, Ms. Eggman. This is an issue that we worked on quite a bit last year and wanted to bring it forward again this year. And last year we had proposed an extended producer responsibility type of approach to dealing with sharps, needle sticks, and the issues that the sharps represent out in our community. Met quite a bit with stakeholders and folks who are interested in this bill. And there's a broad range of opinion, broad range of issue out there that everyone was bringing to the table. And what we ended up with was focusing the bill down on a simple requirement that sharps that are sold, that are distributed in California, come with a container and come with an indication on the container or with the container how to dispose of sharps in their community, which is one of the pieces really that's been missing. Now, I know that there are a number of folks who've been contacting your offices, my offices, and I'm assuming we'll get testimony today, who are very concerned, who are sharps users, needle users. And we're very happy to work with them because the issue is not to put undue costs or impact the users, but to get that supply chain, get everybody who's a stakeholder in this a part of a solution. In fact, I'm disappointed that we didn't get more cooperation from the industry in working through what is clearly an issue out in our communities, especially with the folks who are hauling waste. A lot of people that we've talked to don't know what to do with the sharps once they've used them. They end up in unsafe containers. They often end up in the trash or recycling bin. Folks don't know what to do, and that leads to negative results when people in the waste stream do get stuck by the sharps. So this is really a first step towards addressing the larger problem of the proliferation of sharps out in our community by creating a mechanism, a vehicle that would allow for a safe container for them to be put into, and then it will be up to the consumer to drop that off at an appropriate location. That aspect of it is something that we can continue to work on. I'd like to ask Ms. Eggman to join me up here and give her testimony as well.
Morning, Chair. Good afternoon. It's been a long day for all of us, I'm sure. Good afternoon, everybody. So I guess just basically I want to say the law is you cannot throw sharps or needles. So we're saying sharps, but in the common vernacular, it's needles. People who use injectable drugs of some kind, intramuscular drugs of some kind, they have needles. It is against the law to throw those needles into the garbage can. But we don't provide any means for people to dispose of them any other kinds of way. So as Mr. Stone said last year, we had a more robust bill that faced a lot of opposition. So we scaled back. We brought stakeholders together. We said, what makes sense? People need to know how to follow the law. People need to have a means to do that. We don't need to have waste haulers getting stuck, passing disease, or find them on beaches or all kinds of places. So this simply says when people purchase their needles, they get them through Medi-Cal, whatever program they're getting them through, they also get a container to dispose of them in, so they're not putting them in Coke cans and Clorox boxes and all kinds of things like that, which then go into the trash. People don't know they're in there and they can get stuck. So this basically says providing a container at point of purchase and then with directions where to drop that off. Easy bill. Safety, public safety issue. Thank you.
Thank you. What witnesses in support?
We do.
Are you ready for witnesses? Okay. 2 witnesses.
Members, Pete Price with Waste Management. It's our workers who work on the sort lines at recycling centers. And by the way, most of what you dispose of in one of those cans at your homes these days doesn't go directly to a landfill. It goes to some sort of processing facility where we have men and women on sort lines. And so sharps are a unique problem. Among all these hard-to-handle materials that we'd like to keep out of the landfill, sharps are a unique problem because they pose a significant worker safety hazard. We've had members get stuck, our workers get stuck before. Some of them have testified in past years on prior versions of this bill. So the authors have been upfront about how this is a partial solution, and we are concerned still about what happens if people put their needles in this container and then it's thrown in the trash or recycling. I think that's something the legislature still needs to deal with, but we want to support this bill, as they've said, as a partial solution and an important first step. So we support the bill.
Thank you, Mr. Chair and members. My name is Jason Schmelzer, and I'm here on behalf of the California Product Stewardship Council, who's one of the co-sponsors of the bill, as well as the California chapter of the Solid Waste Association of North America. Earlier on another bill, I think it was a former president of the American Diabetes Association referenced an increase in diabetes in the state of California. It was 38% when compared to some other states. But the part that caught me was that the sheer numbers are so massive. And I want to draw a line from that to our issue. You're going to see more and more home-generated sharps in California. You already are. So the question becomes, what are we doing with the waste at the end of the day? No matter how helpful these things are in our everyday life, and they absolutely are, and we don't disagree with that, the fact of the matter is that there is a very real end-of-life impact for these products, and there are, as Mr. Price indicated, solid waste workers, folks that we, the legislature, all of us, have asked to hand sort our garbage, to pull additional recyclables out, so we can meet our environmental goals. We have asked them to put their hands in this garbage, okay, as a state of California. The question becomes, how are we protecting those folks? Right now, these things are banned from disposal, but consumers, those folks that are outside of the population that no matter what is going to do the right thing, right? They're busy, they're a single mom like I was raised. They don't have time to go out to the household hazardous waste facility, way far out of town. The question is, how do we make it easier for these folks to safely dispose of their sharps? This bill takes a very modest step and says, hey, here's a container, here's some education, please do the right thing. Prior to my days as a lobbyist, I was a workers' compensation claims administrator. I actually talked to a lot of folks. And I had occasion to talk to folks that had been victims of needle stick injuries. And I will tell you this, it's a very emotional situation. Try imagine being at some point in your life when you're at childbearing age, or you're in some very developmental part of your life. And then imagine getting stuck by a needle in the garbage, not knowing where it came from, not knowing what type of medical treatment you're going to have to go through, how you're going to have to press pause on your life. It's a very real thing that's happening in the state of California, and for those reasons, we're in strong support of this bill. Thank you.
Thank you. Additional witnesses in support, just the organization name and position.
Bill Remake, California Hepatitis C Task Force, in strong support.
Thank you. We do have, is there, Mr. Broad, did you?
Yeah, Barry Broad on behalf of the Teamsters. These are our members getting stuck by these needles, and it's a lot to be put through. Urgent aye vote.
Anthony Gonsalves, representing the cities of Roseville and Torrance. We're in support. Thank you.
Thank you. Back microphone. Thank you.
Jerry Jeffy, representing the California Chronic Care Coalition, in support.
Kiara Ross on behalf of the cities of Riverside and Sacramento, in strong support.
Leslie McFadden on behalf of the Sacramento County Board of Supervisors, in strong support. Thank you.
John Dane, representing California Resource Recovery Association, also in strong support. Thank you.
Nicole Wertelman on behalf of the Alameda County Board of Supervisors, in support.
Jonathan Clay on behalf of the County of San Diego, in support.
Kelly Brooks Lindsay on behalf of the California State Association of Counties, also in support.
Sue Vang with environmental group Californians Against Waste, in support.
Tom Erickson, Ultimed, in support, and we are also a manufacturer of sharps, and I want to invite the committee to ask questions of us and me if you have any technical things on how the sharps are handled from the business standpoint. Thank you.
Right. Witnesses in opposition, and actually, while they're coming up, Mr. Stone, I think there were some technical amendments. Were you willing to accept those?
Yes, absolutely. We're willing to accept those and clarifying the FDA approval of the containers.
All right.
Yes,
thank you. Thank you.
One more witness in support, please, Mr. Chairman. Josh Pane on behalf of the California Refuse Recycling Council, in support, and would be happy to answer any questions.
Okay. Thank you. Witnesses in opposition?
Chairman and members of the committee. First of all, here's the Ultimed container. Joke of a life, I'm sorry to say. This is one of the poorest constructed I have seen. Here's all your needles that come up to approximately right here. Tell me all of these will be stored in the top. They will not, which is going to cause, unfortunately, many, many more purchases of these for our families. My name is Mary Andrews. I am co-founder of the Magic Foundation for Children's Growth. I am here representing families from the state of California, from the more than 27,000 children and adults we support affected with endocrine disorders, whereby most require daily injections. We are appalled by the fact sheet, totally appalled by the fact sheet, stating that our members contribute to the problem of needle stick injuries experienced by workers in the state. How can you assign blame to our members when you lack data, evidence, and science to support your facts? I took a survey just last week, and while your data states 3% flush needles down the toilet, our survey showed 99.77% never did such a thing. Even more shocking is that your data shows 4% of users put used needles in a puncture-resistant container, when our research proves nearly 90% use sharps containers. How do you propose a bill without data to prove that? Drug and IV users still roam the streets of America, and where do you think their syringe disposals are going? In a sharps container? We all know that is impossible. How is your bill going to tackle the problem of these individuals? In January, the City Council of Santa Cruz forced the closure of a syringe exchange program that provided IV drug users with a clean works for more than 20 years. Why? Used syringes littered their parks, playgrounds, and beaches, which triggered the shutdown. So why are you putting the cost on those that are responsible and do nothing for those that are truly causing the problem? What are you possibly thinking? And why can you not focus on the real problem and not blame and put fault on the poor children affected with these disorders? You state 14% of self-injected sharps are illicit drug users. Of the 390 million sharps generated each year by an estimated 1 million Californians that inject medications outside healthcare facilities, that leaves 54,600,000 sharps used by the illicit drug users each year. You are not solving the problem. You're just adding a burden and a cost to the affected families.
Please wrap up, ma'am. Thank you.
What was that?
Time is up, so if you can wrap up.
Okay, well, I got a lot more to say, and unfortunately it came all the way from Chicago, so it's a sin you're shutting me up. But anyways, there's over 630 sharps collection sites in the state of California. Our families are responsible. This bill is horrible. We are asking that you stop this bill, work with the organizations so we can actually put a bill together that will work for everyone. Thank you.
Thank you. Next witness, second witness in support. We take 2 witnesses only.
Thank you, Mr. Chairman. I'm glad to be back in front of you. I will remind you of the comment you made earlier about how smart I am, so thank you very much. My name is Stuart Perry. I'm with the National Diabetes Volunteer Leadership Council. I bring you greetings from the Commonwealth of Kentucky, the home of bourbon, Kentucky Fried Chicken, and the Derby. I rise to speak against this bill, Mr. Chairman, with all due respect to the learned sponsor. Putting the fix for this on the backs of people with diabetes is just wrong. It's just wrong. We have enough to live with. We didn't try to get this disease. We didn't ask to get this disease. But putting this on our backs is wrong. I'm not going to argue whether anyone gets sick or not, because there's no data to show whether they do or not. The pen that I use, you have to work. If you're going to try to stick yourself other than the prescribed method of injecting the medication, you would have to work exceedingly hard to do that. I would tell you that one of the people who testified earlier said this is an easy bill. It's very easy if you don't have diabetes and don't use needles. It's a wonderfully easy bill. It's not an easy bill to put it on the backs of people that struggle to pay for their medication each and every day. We need to work on the supply system. You know, right now, Medicaid doesn't pay for pen needles and pens. They're making them use vials and needles. there are ways to clip those needles. There are lots of ways to dispose of this. I can tell you that in spite of what you heard earlier, a Clorox bottle is almost just as thick as the sharps containers. And you know, most public bathrooms have them. However, I would like to tell you that the one right behind that wall doesn't have a sharps container in it. And if the California is extremely serious about this, I would wonder why the state public restrooms don't have sharps containers in them. And maybe these proponents of the bill could afford to give you some money to put those in there. It is, yes ma'am, 1 minute, takes me 1 minute to introduce myself, ma'am. I'm from the South and kind of slow. The slowest thing I can say is this bill is not ready for passage. I'm not going to tell you it's a bad bill. I'm going to tell you it's a premature bill. And you need to send it back to where it came from and start over from day one. I would also like to tell you that if you had questions, Janine Jason, who has a business card that's exceedingly important looking, former CDC and has a whole alphabet behind her name, is sitting to my left and is very capable of answering any and all questions you might have from a medical perspective on this issue. Thank you, Mr. Chairman.
Okay, thank you. Additional witnesses in opposition, name, organization, and position.
Tom Boyer, Novo Nordisk, strong opposition to the bill. A lot of unintended consequences to patients.
Mr. Chair and members, Maureen Higgins representing AvdaMed. We have an opposed unless amended position on the bill. We support the data collection provision and oppose the remainder.
Jimmy Jackson, Biocom, oppose unless amended.
Eve Bukowski with the California Healthcare Institute. We also are opposed unless amended. Thank you.
David Gonzalez on behalf of Bay Bio. We do have an opposed unless amended position. Thank you.
Jennifer Snyder on behalf of the Biotechnology Industry Organization, National Bio, also opposed unless amended.
My name is Teresa Tucker. I'm the other co-founder of the Magic Foundation, a resident of San Diego County, a parent of an affected child, and I oppose strongly this bill.
Okay. Seeing no other witnesses, questions from committee members? Yes, Mr. Chesbrough.
Well, first of all, so I won't violate the privacy of the family member, there's someone in my family who injects daily, and frankly has been very frustrated that she's been unable to easily dispose of the sharps. And I think that this is a very important step in this bill, and I'm very supportive. My only question, and maybe this has already come up, I apologize, I was in another committee hearing, so, my only question has to do with whether when a container has to be provided relative to the number of sharps. For example, this family member of mine has a medication that is perishable and needs to be refrigerated, and so basically receives a month's supply. So, getting one, large container every month that could last 6 months is impractical. So, whether you could, I'm sure you've already heard this issue in letters or other communications, but if you could just look at whether there's a way to address that issue to make it more practical and perhaps less wasteful, because we certainly don't want to generate containers that aren't needed. So that would be my only input and question.
Absolutely. That is an issue that has been raised, the size, the number of sharps that are being delivered. Some folks inject monthly and requiring a much larger container. These are pieces of the bill that we would love to sort out and work with the industry on. As we said last year, as we brought a lot of people to the table, we're still lacking the involvement of a number of sectors in the industry to help us through this problem. We would absolutely love that. What we're trying to do is put a bill forward that in some ways is the least common denominator of a pretty good sized coalition of folks who thought this would be a step in the right direction. We still are happy to work on some of those details, but to abandon this effort and leave the workers and others to the needle sticks doesn't seem the right solution either.
I might add, as a previous author of attempts to require the industry to take responsibility, that's a far preferable path, but I understand why you're on this path as a more politically practical and possible path to achieve. But I continue to believe that it is shameful for the industry to not step up and take responsibility for this issue, for all of the people who depend on injectables every day. That's certainly the path I would prefer, but I think that I understand completely, and I think you would probably echo the same sentiment.
Yes.
Mr. Chavez.
Well, this is a really good bill, and I appreciate the discussion. Oftentimes, I think sometimes we look at bills, we haven't really identified a problem. It seems like we're just finding solutions. But I think you've identified a real issue, and the issue is, as demonstrated by the testimony of, the disposal of these. Somebody who is diabetic type 2, who checks himself once in a while, there's always the issue of disposal. So, but I'm intrigued on the claims by the opposition saying that they weren't brought into this, and it's a moving in the process in the right direction. Where would you want this to go? Maybe the doctor who hasn't had a chance to talk. What is the solution? I think, in all fairness, Councilmember Stone and Eggman have identified an issue. We know it's an issue. They have a solution. My question to you is, what would you like to add to make this a better bill?
I can tell you what I would personally think would make it a better bill, and I don't want to get involved in the politics back and forth. Really, my interest is the science of how many needle stick injuries occur in a community setting and what are the real risks. And with that in mind, a lot of the data in the bill document is largely anecdotal, and I think it's important to get actual data. The one supposed study that was referenced is actually from 1992, and it uses Department of Labor data that, in my research, I quickly realized was not adequate for a number of reasons. That study that they quote does not mention that over 3/4 of the cases are healthcare worker. The next largest group are farm workers, and the next largest group are supervisors. So there's clearly something wrong with those data. The research I did used nationally representative data from CDC and the National Center for Health Statistics. So I think data collection is important in terms of identifying what the problem is and who the problem affects. In terms of sanitation workers, it is important to be concerned about the emotional effects of needle stick injury. The reality is the risk is extraordinarily limited in terms of infection secondary to those. There has never been a case of either hepatitis C, hepatitis B, or HIV, the three pathogens of real concern. There's never been a case documented in the United States from a community, non-healthcare setting, needle stick injury. So I think the problem needs to be quantified and identified more clearly. On a personal level, if we wanted to do something in a cost-effective way that we know would help sanitation workers, one would be a targeted survey or study looking at what the actual risk is, how people respond to that risk, and how they're treated and prophylactic if needed. NCHS and NIOSH tried to do a study like that about 10 years ago and found there were so few injuries that even with targeting they couldn't get an adequate number to analyze. I think organizations like Waste Management or Republic could do their employees a real service, and they'd be the ones to target and do a study, a short prospective study to see how much is occurring, what the risks are, and how these things should be handled. The other thing they could do, which would be an incredible help to their employees, would be to offer them free hepatitis B vaccine. By far the highest even theoretical risk of any needle stick injury is hepatitis B. It's the most infectious. There is prophylaxis, but there is a wonderful vaccine. And if employees were vaccinated, even if they had a needle stick injury, your hypothetical risk goes down virtually to zero. It's close to zero anyway. So I would suggest adding good research and assistance with hepatitis B vaccine would be an incredible addition to this bill.
So if what I hear you saying, Doctor, is that you're saying, as presented, the problem or risk as presented isn't a real problem?
We don't really have adequate data to identify the problem. And certainly the risk of transmission of bloodborne pathogens, what data there are suggests it is not a real risk.
Mr. Chairman, I'd like to move the bill.
Second.
And
Been moved and seconded.
Rocky's, no, you done?
No, I wasn't.
Okay, I apologize. I'll wait.
Yeah, let Mr. Chavez finish.
Well, I just want to make the statement because hearing the opposition, the point is, I don't think anybody in California is trying to put a disparaging comment or paint over somebody who's dealing with a medical issue. So the argument on that side didn't sway very much because I know the assembly members that are carrying this bill, they're just looking at trying to find a solution. But I am intrigued by the issue you're saying that there's no data that shows there actually is a problem we're trying to solve, that the risk is actually to the medical professionals, I think you said were the highest risk, and which obviously wouldn't be dealt with this. So thank you for your, yes ma'am?
Oh, I just thought it might be helpful to mention, in the research I did, I think the most striking finding was not only even in a community setting, so non-healthcare employees as well as the public in general, there are very few emergency department treated needle stick injuries. And although the rate of diabetes requiring insulin has gone up logarithmically and continues to, the rate of these injuries has not gone up one bit.
Thank you, ma'am.
Other questions?
I just, if I may,
Mr. Chesbro. Okay, I'll give you.
I won't do it again. This is my second bite at the apple. But I just want to close by saying we have a healthcare system that spends millions and millions of dollars disposing of sharps as medical waste. But people who use these in their homes, in their private lives, don't, in many cases, have a safe way to dispose of them. And that's a dichotomy that is just astounding to me.
All right, any other questions? Okay. Seeing none, so I think, Mr. Stone, I think one of the things that I think, as Mr. Chesbro brought up, is the issue around the ratio of containers versus. I do think that there, and we're going to have a hearing, actually, the Committee on Labor as well, with a joint hearing with the Committee on Health on the issue of risks of needle sticks, and because I think that actually. We could ask the folks who are testifying on behalf of Waste Management and public about what their experience is in terms of, and where, the data sources of data for needle sticks. What that may be more anecdotal, but it's kind of like, well, what are you seeing? And you've actually the good doctors proposed we should perhaps do a study. In fact, I see the witness coming up. Do you wish to make a comment perhaps on the testimony that this isn't a problem or a minimal problem?
Barry Broad on behalf of the Teamsters. I can tell you this. The biggest workplace concern for my members is needle sticks. And because these needles are so small, they're hard to detect. And we've been wrestling here in the legislature for 20 years with this issue, so it's hardly premature. Maybe this isn't the perfect bill, I don't know. But it's not premature, and it needs to be dealt with. And what happens is, well, let's say their numbers are right, and only 10% of the needles got disposed this way. That's hundreds of thousands of these a week that are winding up in recycling facilities, and they get in people's gloves, and when they get stuck, they basically live in fear for 6 months. And we obviously are sympathetic to people who are diabetic. Clearly, we have members who are diabetic. Everybody knows people who are diabetic. But it's illegal to dispose of these this way, and it has always been, but it's observed in the breach. And there has to be a way to stop this from happening while making it workable for people who have diabetes, because the problem is only growing bigger. So I guess I have to say this is a very emotional issue for my members. What they told me is, oh, God, Barry, if you could do something about this, that would be so great. because our people live in so much fear. And why should people live in this kind of fear? It's just wrong. So we would urge you to find a solution.
Mr. Chairman, Josh Pane on behalf of the California Refuse Recycling Council. We have a member company that one person in that company on the pick line has actually been stuck twice. Now, you may say it's a needle in a haystack. The fact is, one person in one of our companies got stuck twice. Now, if it's your mother or your brother or your aunt and uncle who gets stuck, then I guess it means something. One is too many. The idea that it would cost $1 for every 100 sharps to provide a consumer container. That concept, $1 for every 100 sharps. Think about that concept. 7 years ago, the industry that got up here and testified against this bill, there was a mail-back program that passed this legislature, got to the governor's desk. That program, this industry that got up, said, I'll quote from them, from the analyses, argue the duty to ensure safe disposal of sharps rests with the consumer. Now they're protecting the consumer in this bill. No, they can't have it both ways. $1 per 100 sharps is not too much, and it should be the marketplace that takes care of that. We have one sharps manufacturer that actually offers this. Others will offer it if one is offering it. We ask for your aye vote.
Okay, well, I think with that, I think the other issue that has come up certainly is that in terms of the cost to the consumer, I know that's something you've been wrestling with as well. I think there's some sense about, we do have patients who have these chronic diseases who are not of well means, and there's a way to figure out how to, whether it is the vehicle or other ways, think about how we can get coverage or some way for people to, as part of the cost of the fact that that's what costs to take care of them. Something we can work out there that I think would be helpful as well. So some of the things that perhaps think about as the bill moves forward, but I think you are trying to address, I think, an issue that resonates with a lot of people. I'm recommending an aye vote, and I invite you to close.
Thank you. Thank you. This was an issue that was brought to us by the workers who are getting stuck and afraid of it, and distinguish the medical workers, the health workers, from the community members, from the waste stream. Very different issues. The needle exchange program in Santa Cruz is alive and well, and the city and the county are working on making sure that it fits within community expectations. So that was part of the testimony, but it does resonate in our communities, and trying to address each segment of it is what we're trying to do. We do not want to put a burden on any one part of this supply chain, specifically the consumers. You're right. I think our biggest sympathies are there, but yet without a solution to a real problem and without anybody really coming to the table to help solve, we're putting an idea forward. We think it's practical. We think it works, and this is what we're respectfully requesting your support for.
Okay. With that, it's been moved and seconded. Motions do pass as amended to appropriations. Secretary, please call the roll.
Pan.
Aye.
Pan, aye. Mainshine. Amiano. Chow. Bonilla. Bonta. Chavez. Chesbro. Aye. Chesbro, aye. Gomez. Gonzalez. Hernandez. Lowenthal. Waldron. Nazarian. Aye. Nazarian, aye. Nastandi. Aye. Nastandi, aye. Patterson. No. Patterson, no. Ridley Thomas. Aye. Ridley Thomas, aye. Wagner. No. Wagner, no. Wykowski. That's five.
You have 5. The bill's on call, and come back around. So.
Thank you, Mr. Chair.
Thank you very much. Thank you.